Okay, so this is about that problem which was presented to me about inferring the results of a meta-analytic review examining the association between diabetes and the dental implant failure. The problem presented was that 4 studies examined the association between diabetes and dental implant failure. This table, it summarizes the results of a meta-analytic review involving these studies. Here we can see that study 1, 2, 3, and 4, and then their overall estimate. And we assume that the alpha level is of 0.05. So what would be the results which we can infer from these studies and the overall estimate? From the given table summarizing the results of a meta-analytic review examining the association between diabetes and dental implant failure, we can make several inferences based on the risk ratio and their 95% confidence intervals for each study as well as the overall estimate. Let's understand this table. The study 1, its relative ratio is 0.10 and the 95% confidence interval is 0.01 to 1.64. Study 2 is 0.57 is the risk ratio and 95% confidence interval is 0.23 to 1.39. Study 3, its risk ratio is 1.15 and 95% confidence interval is 0.74 to 1.79. And study 4, its risk ratio is 3.35. The 95% confidence interval is between 0.70 to 15.96. So overall estimate of these studies is risk ratio is 0.9, whereas 95% confidence interval is 0.62 to 1.32. It is between that. So interpreting the risk ratios and confidence intervals indicates risk ratio, it indicates the relative risk of dental implant failure in patients with diabetes compared to those without. Like if we have one control group where patients, they were having implants, but they were not having diabetes. So relative risk ratio is less than 1, suggests a low risk of implant failure in the diabetic patients. And relative risk more than 1 suggests a higher risk of implant failure in diabetic patients. But if it is relative ratio of 1, no difference in the risk between diabetic and non-diabetic patients. If we look at the 95% confidence interval range of values within which we can be 95% confident that the true risk ratio lies. If the CI includes 1, the result is not statistically significant at the 0.05 alpha level. We cannot reject the null hypothesis of no association. If the CI does not include 1, the result is statistically significant at the 0.05 alpha level. So again, this same chart, study 1, we have discussed about it. CI includes 1 if we look at it. Not statistically significant. Suggests a potential lower risk, but the wide CI indicates high uncertainty. There is a wide CI. Then study 2, again, CI, it includes 1. Not statistically significant. It suggests a potential lower risk, but again, not conclusive. Then comes the study number 3. CI includes again 1 in it. Not statistically significant, suggests no significant difference in the risk. Then comes study number 4. CI includes 1, not significantly significant, suggests a potential higher risk, but with high uncertainty due to wide confidence interval. Though the relative risk is 3.35, but there is a wide range of confidence interval, so uncertainty. The relative ratio overall estimate is 0.9 and the confidence interval is 0.62 to 1.32, which includes 1. Again, not statistically significant. It suggests no significant overall difference in the risk between diabetic and non-diabetic patients. So we can say that, in summary, none of the individual studies show a statistically significant association between diabetes and dental implant failure at the 0.05 alpha level, since all their CIs, they include 1. The overall estimate also shows no statistically significant association as the CI includes 1. Thus, based on the available data, there is no conclusive evidence to suggest that diabetes is associated with an increased or decreased risk of dental implant failure. Good. Does it make sense to you? Great. So the answer is that it is not conclusive and we cannot, that there is no, we cannot reject the null hypothesis. So the answer according to your problem is correct over here. Okay, good.